Retrocalcaneal bursitis or Achilles bursitis. A bursa is a fluid-filled sac-like structure that sits between a tendon and a bone, providing a cushioning effect for ease of movement. The retrocalcaneal bursa is situated in the feet between the Achilles tendon and the calcaneus, or the heel bone, and serves as a cushion to absorb impact when walking. So here we have the calcaneus bone, the calcaneal bone, the Achilles tendon, and the retrocalcaneal bursa, meaning a bursa situated behind the calcaneus. Causes and risk factors for retrocalcaneal bursitis. This condition is usually due to repeated trauma like too much walking, running, or jumping, especially if you suddenly increase the intensity of your workout schedule or by increasing the activity level without the right conditioning. This condition can affect both men and women equally. The clinical complaint of retrocalcaneal bursitis. Pain, being the commonest symptom, is centered on the heel and is intensified with walking, running, or when the area is touched. Pain also typically increases when you stand on your toes or tiptoeing. Sometimes a swelling and red warm skin over the area could appear. Making the diagnosis of retrocalcaneal bursitis. The doctor will take a brief history to find out whether you have typical features of retrocalcaneal bursitis. Physical examination will reveal swelling or tenderness of your heel around the insertion of the Achilles tendon, which is a hallmark sign. Initially, X-rays and imaging methods are not needed. But if the conservational management fails, ultrasound and MRI examination may be needed to determine further management. The treatment of retrocalcaneal bursitis. Bursitis treatment focuses on relieving inflammation and pain and preventing complications and future recurrence. Medications, in most cases, non-steroidal anti-inflammatory drugs, can help relieve pain and inflammation. Non-steroidal anti-inflammatory drugs include ibuprofen, like Advil, and naproxen, like Aleve. Other non-steroidals, as well as higher doses, are also available by prescription. Local topical application of anti-inflammatory ointments such as diclofenac or Voltaren is also a good option to rub at the area. Protecting the joint. Modifying the footwear to reduce pressure on the back of the heel, for example, cutting a V-shaped groove into the back of the shoe or using a pad inside the shoe to lift the heel are great options. Other measures, such as applying ice, can help relieve pain, particularly for bursitis affecting superficial areas like the heel. In many cases, physical therapy can help treat symptoms of bursitis and prevent future recurrence. The optimal exercises depends on the type and severity of the bursitis, but may involve stretching, strengthening, or working to improve and maintain range of motion.